Welcome to Humanautic, unlocking the secrets inside your body and brain. Hello Humanauts, in today's video, we'll walk through how to perform a tracheostomy step by step. A tracheostomy is a surgical procedure where an opening is created in the trachea through the neck to establish a direct airway. This procedure is commonly performed in patients who require long-term ventilation, airway protection, or relief from upper airway obstruction. Let's go. A tracheostomy is typically performed for several key reasons. The most common indication is prolonged mechanical ventilation, usually when patients need ventilatory support for more than 7 to 14 days. Other indications include upper airway obstruction, severe facial or neck trauma, neurological conditions where patients cannot protect their airway, and situations where patients are unable to clear airway secretions effectively. Unlike emergency airway procedures, tracheostomy is often performed in a controlled surgical setting. Before performing the procedure, understanding the anatomical landmarks is essential. Key structures include the thyroid cartilage, the cricoid cartilage, the tracheal rings, and the thyroid isthmus. The tracheostomy opening is typically created between the second and third tracheal rings. Care must be taken to avoid injury to the thyroid gland and nearby blood vessels. The basic instruments required include a scalpel, hemostats, retractors, a tracheal hook, tracheal dilator, suction device, and the tracheostomy tube. The patient is positioned supine with the neck extended, often with a shoulder roll placed beneath the shoulders to expose the surgical field. Let's now go through the step-by-step surgical technique. Step 1. Skin preparation and incision. The neck is cleaned with antiseptic solution and draped in a sterile manner. A 2 to 3 cm horizontal or vertical incision is made just below the cricoid cartilage. Step 2. Dissection through soft tissue. The surgeon carefully dissects through the subcutaneous tissue and platysma muscle. Bleeding vessels are controlled using electrocautery or ligation. Blunt dissection is then used to separate the strap muscles, which are gently retracted laterally. Step 3. Exposure of the trachea. Once the muscles are retracted, the trachea becomes visible. The thyroid isthmus, which lies over the trachea, may be retracted upward or divided and ligated to expose the tracheal rings clearly. Step 4. Stabilizing the trachea. A tracheal hook is used to stabilize the trachea and prevent movement during the incision. This ensures greater accuracy when entering the airway. Step 5. Creating the tracheal opening. An incision is made into the trachea, usually between the second and third tracheal rings. Different techniques may be used, such as a vertical incision, horizontal incision, or a Bjork flap. Air movement through the opening confirms entry into the airway. Step 6. Dilating the opening. A tracheal dilator is inserted to gently widen the opening in preparation for tube insertion. Care must be taken to avoid damaging the posterior wall of the trachea. Step 7. Inserting the tracheostomy tube. The tracheostomy tube is then inserted into the tracheal opening. The obturator is removed, and the tube is connected to oxygen or ventilatory support. Proper placement is confirmed by observing chest expansion and airflow. Step 8. Securing the tube. Finally, the tube is secured using tracheostomy ties or sutures, and a sterile dressing is placed around the site. At this stage, the airway has been successfully established. After the procedure, careful monitoring is essential. Patients require regular suctioning, proper tracheostomy tube care, humidified oxygen, and monitoring for bleeding or infection. Possible complications include tube displacement, infection, bleeding, and subcutaneous emphysema, so vigilant observation is important. Understanding airway procedures like this is essential for anyone training in surgery, emergency medicine, or critical care. If you found this video helpful, like, share it with your fellow Humanauts, and subscribe to the Humanautic for more surgical education.